Hi, dear colleagues. This is a simple case of tractional retinal detachment in diabetic eye. Here you can see patient got a good pan-retinal photocoagulation, and I am doing the core vitrectomy and cutting the posterior highlight. And here I am doing segmentation with the cutter. This is more fibrous tissue, less vascular, but here you can see as I cut the fibrovascular proliferation, I got the bleeding. So here is a small lesson that if you get the bleeding, don't worry, just leave it. It will stop by itself. Just finish the other steps of the surgery like I am doing here. But unfortunately, as I started the other steps, I got bleeding again. And again, I didn't worry, and I continued the segment, the other parts of a fibrous tissue. I'm not worried about and watching the bleeding. Now, as it times pass, it got clotted, because if it will not clot, it will be difficult to aspirate it all the time. It will keep on coming. Here you see, I have clotted, but it is coming again from that vessel. I am not doing going to do cautery near the optic disc, so don't worry. Just aspirate it and finish the other steps of the surgery. As the time will pass during the surgery, it will clot. Don't be in hurry to aspirate it, because if you will keep on aspirating, it will keep on bleeding. So here you see, I just press the area of the bleeding with the aspiration of my cutter, and it sometimes helps to stop the bleeding. And then I start the aspiration again of the hemorrhage, and I am doing it from the other side. And you see, we got the 2 points. One point was stopped bleeding by itself. Second, I did stop by compressing the and aspiration of the cutter used to stop the bleeding. I didn't use any cautery over there. So at the end, you see, with the patients, I have completed all the vitrectomy, and at the end I am just aspirating the clotted blood. And here you see, now there is no bleeding of these 2 points that I've shown you, the first one and second one. First one, the bleeding stopped by itself. Second one, I did a little bit, use the tip of the cutter to aspirate that hold with the vacuum, and here you can see it's not bleeding also now. Rest of I am using the extrusion needle to aspirate the remaining blood. So here is a small lesson, that if you get the bleeding, don't be in panic. Just let it clot by itself, and when it clots, then try to aspirate it and remove it. Don't be in hurry, because the bleeding will stop by itself. So you don't need to be hurry, and sometimes rarely you need the cautery. I don't like to use much cautery during the surgery. You can use the different tips during to stop the bleeding. That may be uh, raised a bottle height to raise the intraocular pressure, or use the vacuum of the cutter to hold the bleeding vessel, or you can use the perfluorocarbon liquid to stop the bleeding. So these are just basic tips for tractional retinal detachment and bleeding during the tractional retinal detachment surgery. Obviously, less bleeding is when there is a more fibrous tissue and less vascular tissue, and it is better to give anti-VEGF before surgery. Then you can get more fibrous tissue and less vascular tissue. When you get the less vascular tissue, you have a less chances of bleeding. When there is a less bleeding, your surgery is less complicated and get good results. Thank you so much.